This is our client, Stephanie. Hi, Stephanie.
Hello, I give my consent.
So today we're going to be completing this ECG, and first we're going to have a gauze pad and alcohol, and we're going to clean the surface of her skin so that there's a clean reading and that it gets blood to the surface. Now at this point, once the skin is clean and you see a nice red surface, we're going to apply the electrodes and complete the reading. The chest leads are V1 through V6 and are placed like so. V1 is in the fourth intercostal space on the right margin of the sternum. V2 is also on the fourth intercostal space, but on the left margin of the sternum. V3 is on the linear midpoint between V2 and V4. V4 is on the fifth intercostal space at the midclavicular line. V5 is horizontally adjacent to V4 at the anterior axillary line. V6 is horizontally adjacent to the V5 at the mid-axillary line. It looks at the electrical activity along the horizontal or transverse plane. You would expect V5 and V6 to have the highest deflection for the QRS complex because they're near the apex of the heart. Next is the main limb leads. This goes along the sagittal or coronal plane. The main limb leads are 1, 2, and 3, and the augmented limb leads are AVR, which is the right arm, AVL, which is the left arm, AVF, which stands for the left leg, and the right leg is the ground.
This is my ECG reading. It's got a normal sinus rhythm and it shows all waves of the heartbeat.
This is the Einthoven's triangle. It is the limb leads consisting of lead 1, 2, and 3. Now the augmented unipolar limb leads are AVR, AVL, and AVF. The AVR lead, for the electrode it goes on the right arm, AVL corresponds with the left arm, and AVF corresponds with the left leg. Now the right leg is the ground, and this is looked at electrical activity from the coronal or frontal plane.
The normal sinus rhythm is between 60 and 100, and it's the normal heart rate. Bradycardia is a slow heart rate, and it's less than 60 beats per minute. Tachycardia is a fast heart rate, and it's more than 100 beats per minute.